Hi, let's dive right into the indications for GLP-1 medication therapy in this second video on Zepbound. You've probably seen the news: Ozempic for weight loss, Mounjaro, Wegovy, Saxenda, Zepbound, incredible breakthroughs in the treatment of obesity. But let's talk about the indications for these medications and who might consider trying them. I've included a fun quiz at the end to test your knowledge, so watch to the end to see how you do. Now, generally speaking, anti-obesity medications are approved for the treatment of obesity, as defined as those with a BMI greater than 30 or 27 with an obesity-related comorbidity, such as insulin resistance, sleep apnea, high blood pressure, high cholesterol, personal family history of heart disease. It's easy to argue arthritis, non-alcoholic fatty liver disease, chronic back pain, depression, and so many more are complications of obesity, but it's harder to convince your insurance company of that. Now, BMI is not a perfect measure. There are a lot of factors that affect it, such as muscle bulk, chronic illness such as congestive heart failure, lipodystrophy, and many more. But it's an easy measure and one we can track in the office. I've had patients denied because their BMI was 29.7. They literally needed to gain 2 pounds or lose half an inch for their insurance to improve it. Now, strict adherence to these numbers is absurd. A BMI of 30 was chosen as the cutoff because that is the point at which risk of type 2 diabetes rises significantly. But of course, like most studies in the past, this was mainly based on white patients. Subsequent studies have documented the identical risk of diabetes occurs at a lower BMI in Blacks, Chinese, Arabs, and Asians. A BMI of 28 in Blacks, 27 in Chinese, 26 in Arabs, and 24 for South Asians. So clearly we need to use our brains when it comes to deciding who meets criteria for GLP medications. If the goal is to reduce the risk of diabetes and obesity-related conditions, we need to adjust the BMI cutoff for therapy based on our individual patient, not a single number. Now, this can get into off-label prescribing of medications, but we've been doing that literally since the first day a label was created. If you're enjoying this video, please give it a like below and subscribe to our channel. There are big things coming with the merge, and we'd love for you to be a part of it. Now, unfortunately, many insurance policies outright exclude anti-obesity medication coverage. This isn't the company per se, it's the policy that the employer or the patient covered. To add coverage for a $1,000 a month medication significantly increases the premium of the policy, and many employers have decided to not purchase this coverage. Generally, government-sponsored plans such as Medicaid and healthcare.gov policies do not offer coverage either. I recently searched healthcare.gov for a policy for my family of 4. I was given 83 plans to choose from, usually with $1,400 monthly premiums and a 20% coinsurance with nearly a $10,000 deductible. But when I told it to only show me policies that covered Wegovy, that 83 dropped to 0. But many of them will cover weight loss surgery.
So stupid.
GLP medications, such as Zepbound, do have several contraindications, meaning a reason a patient should not take the medication. Let's go through them. Obviously, if you are allergic to any of the ingredients, you should not take it. Some people get localized injection site reactions, which is okay, as long as it does not cause systemic symptoms of an allergic reaction. There is a risk of pancreatitis with GLP medications, so if you have a history of pancreatitis, you should be cautious in starting this medication. Certain types of self-limited pancreatitis, such as due to gallstone or due to high triglycerides, that's a different story. These are due to a treatable condition and are likely fine to initiate GLP therapy as long as there's no active pancreatitis. There is a theoretical risk of medullary thyroid cancer with GLP medications, so if you or a family member have been diagnosed with this specific type of thyroid cancer, you should not take a GLP medication. These tumors have been seen in mouse models, but they have not been observed in humans taking GLP medications at any higher rate than people who are not taking GLP medications. So treating obesity reduces the risk of over a dozen types of cancer, so it's generally felt to have a very positive risk-benefit analysis in relation to cancer risk. If you have a history of multiple endocrine neoplasia type 2, you should not take the medication. If you have a history of gastroparesis, where the stomach does not empty effectively, you should not take the medication. Studies on the safety in pregnancy are being done, but for now it's recommended to not take once-weekly injectable GLP medications for at least 2 months prior to becoming pregnant. This allows times for the medication to wash out of your system. Taking a GLP medication with other medications that lower your glucose, such as sulfonylureas or insulin, can cause hypoglycemia, and you may need to reduce the doses of these other medications. Definitely do this in conjunction with your treating physician. GLPs on their own have a very low risk of causing hypoglycemia, as they only lead to increased insulin release in response to elevated glucose, not independent of it. If you have a history of bowel obstruction or severe constipation, be careful with GLP medications. Semaglutide generally causes more nausea and diarrhea than constipation, and tirzepatide, again Mounjaro or Zepbound, is more known for nausea and constipation. Another thing to consider with these medications is indication to continue therapy. Often insurances will improve the medication for 3 or 6 months and then reassess to see if the medication is effective or not. While most lose significant amounts of weight, Some people are non-responders and may not lose much weight at all. This is rare, but there is no point in taking a medication that can cause side effects if there's no benefit. Generally, a 5% weight loss is considered success on a medication. So if patients have lost 5% in 6 months, insurance will usually approve it for another year of therapy. But you have to be careful on the prior authorizations. You have to document initial and current starting weight, height, and BMI. Now, some insurances require step therapy before approving GLP medications, meaning they will cover it, but not until you've tried every other cheaper medication, such as metformin, phentermine, phentermine topiramate, bupropion, naltrexone. These other medications generally offer less than half the expected weight loss and come with many more side effects. But they are cheaper, and that's why insurance often wants to start with those. You're probably wondering why insurance doesn't see the benefit of spending money today on anti-obesity medications to reduce the risk of spending money later on obesity-related conditions. Now they do, they absolutely do. But they also know that people change jobs frequently, and employers change insurance companies frequently. So a patient is unlikely to be on the same plan today as they will be in 5 years. And the cost savings of money spent today to prevent complications later will likely benefit a different company. This is one of the many downsides of employer-sponsored health benefits, but it's the reality of where we find ourselves. Now, this is a fairly comprehensive list, but there is more to consider regarding who is an appropriate candidate for GLP-1 medications. Speak with your physician regarding your condition and whether these might be appropriate for you. If you'd like to work with Emerge and have us be your physician, please check us out online. I've got 2 partners, Dr. Carr and Dr. Roberts. We're telehealth practice and can cover your urgent care needs as well. Subscribe to our channel below to be notified of new videos, such as the next in this series, where we talk about the side effects and how to manage them. What are the BMI indications for prescribing GLP-1 medications? Which medication does not work on the GLP-1 receptor? History of what condition should exclude GLP-1 therapy? Which of the following is not considered an obesity-related comorbidity? If I take a GLP medication, what else do I need to do to be successful? Thanks for watching, and let's get healthy together.